Good morning, everybody. As promised, I'm here again to talk to you about feminization surgery, facial feminization surgery, about all the steps we can do to improve your result, to improve your appearance, to get a more feminine face on yourself. Okay, so we have to do, or we can do many different surgeries to get the best result here. So we need to see, to check on you, on your face, what's going on to get a feminine face. The most common surgeries we perform is the jawline surgery, the frontoplasty surgery for your forehead, your the feminization surgery for the nose, the rhinoplasty, what it's called, and other different surgeries such as, for example, the chin chin augmentation, the cheek augmentation too, and many other different surgeries. But the most important surgeries we can offer you are the first one, jawline surgery, frontoplasty for the forehead, and rhinoplasty. These three surgeries combined, sometimes in one single procedure, can make an important difference in between what can be a masculine appearance and a feminine one. So for the jawline surgery, this surgery has to be done under general anesthesia, and we what we do usually is to cut off the angles of the jaw in both sides through a single incision inside the mouth. Okay, that's one of the most important things we need to take in consideration. It's not necessary to do any scar outside because we can work inside the mouth without any problem to get the angles of the jaw and to take them off using a special device called the ultrasound device for cut the bone. So we can work inside, not only for the angles, but for the chin too. And usually, even if animation, we can do a chin augmentation in singular cases. Generally, what we need to do usually is just the opposite. I mean, take off the bone, a little bone here, a little piece of bone at the chin to reduce the projection of the chin, the protrusion of the chin, and to get a more feminine appearance of the jawline for trans women. So everything can be done in a single operation. As I mentioned just before, through a single incision inside the mouth, we can treat the full jaw line to get a more feminine appearance. We need to respect two nerves coming out of the bone here in both sides towards the face, towards the front, to receive the sensations of the lip and of the external jaw line skin. Okay. Finally, we'll close with stitches inside the mouth, and the operation is over at this moment. Except in cases in which people want to treat the forehead too, and the nose too. It's very common to combine these three surgeries. So for the forehead, we need to take an X-ray before, okay, to see if in what forehead reduction we are, in what case. We have three different forehead reductions. The first one is the forehead reduction using only the sinus in the middle of the forehead. This sinus is made of mucosa, and it's connected with the nose. And the goal of the sinus is to make humidification and heating the hair, entering in the airway through the nose to get the lungs in the better conditions, in a normal temperature, and in a good level of humidification. So for that we have the sinus surrounding the nose. So the goal of this sinus is just that, to get a correct humidification of the air and a normal temperature before getting the lungs. So what we do is we use this frontal sinus in the middle of the frontal bone to try to make this reduction in the protrusion of the bone, which is a very masculine appearance, you know. So what we do is we cut just in the hairline the skin. We make a flap to get the bone, and the moment you're in the middle of the bone, after having taken measures on the x-ray, we cut off the external part of the bone to get the sinews. We customize this bone, we reduce this bone, and we put it again in the same place it was, but after having reduced the bone. So we have the possibility using the sinews to go from, for example, this place to this other place. You go, you know, deeper inside the sinus with the external table of the bone to make a very good reduction of the protrusion of the bone in trans women with this masculine appearance because of this protrusion. After that, we can reduce the other part of the bone just to get a perfect reduction of the protrusion. And finally, we make a lift of the eyebrows to put them in their feminine position, okay, upwards in the face. So that's the second surgery. We need to accept a scar. This scar will be located in the hairline, but it's not that visible. Okay, and we have the possibility after that even to make a second surgery, to do an implant of the hair just in the middle of the scar to hide it as much as we can. Okay, even to get sometimes situations in which it would be almost impossible to see there was a scar before here. Okay, so that's for the forehead reduction, for the feminization for forehead surgery. The third one is the feminization rhinoplasty. In this case, we try to change especially the angles of the nose and the protrusion of the nose too, and the wideness of the nose, everything, okay, to get a more feminine appearance of the nose. So these three surgeries combined can you know, show us the possibility to make an important change in the face of a trans woman and to switch from a masculine appearance to a feminine one in these three operations that can be performed at the same time along a single operation, in fact. We need to accept the result 2 days after the surgery will be very, very swelling, with an important swelling on the face. So this person needs to accept the postoperative course. Sometimes takes 2, 3, 4 weeks to get a reduction of the swelling. So we need to accept, we need to be off work for these 2, 3 weeks at least. Okay, the stitches usually are removed 10 days after the operation, except for the nose. The first thing we need to do after this surgery is to take off the tampons inside the nose 4 days after the surgery. After that, that's the stitches of the nose, and finally the plaster over the nose and the stitches on the full operation on the head. Okay, so yeah, I think that's more or less I wanted to let you know. We'll be in touch in the case for anything you wanted to know. If you want to have personal consultation, don't hesitate to ask us for in our social media or in our website. We'll be glad to take care of you and to give you all the information, personalized information about your particular case. Okay, so have a great day, and we'll see each other in the next videos. Bye bye.